Pratima from Planet Physiology. In this video, we are going to learn about cardiac cycle. Now, what is this cardiac cycle? Cardiac cycle is defined as cyclical repetition of various changes in the heart taking place from beat to beat. These cyclical changes will be repeated with every heartbeat. Now, how much is the duration of cardiac cycle? Duration of cardiac cycle has inverse relation with heart rate. Normally, heart rate ranges between 70 to 80 beats per minute, and for calculation of cardiac cycle, we consider heart rate as 75 beats per minute. And hence, to calculate cardiac cycle time, we divide 60 by heart rate. So, in this case, 60 by 75 comes 0.8 seconds. Let us study the various events during cardiac cycle. Major events during cardiac cycle will be divided into two: atrial events and ventricular events. Each of these events will last for 0.8 seconds. So, atrial events will last for 0.8 seconds and they are further divided into two: atrial systole and atrial diastole. Atrial systole lasts for 0.1 second and diastole for 0.7 seconds. Similarly, ventricular events will take place for 0.8 seconds. These are also divided into two: ventricular systole and ventricular diastole. Ventricular systole lasts for 0.3 seconds and ventricular diastole for 0.5 seconds. And during cardiac cycle, these events overlap each other. Now, let us understand these events with the help of diagram. Here is how to construct this diagram or how to understand this diagram. Usually, a circular diagram will be shown. So, this inner concentric circle shown in yellow color represents atrial events, and the outer circle shown in this light blue color represents ventricular events. Now, as we have seen, duration of cardiac cycle is 0.8 seconds. So, let us divide these circles into 8 equal parts. Each part represents 0.1 second. Now, this division will help us to understand and to plot or mark the various events in the cardiac cycle. Cardiac cycle always begins with atrial systole. Why is that so? If you remember your conducting system, pacemaker of the heart is SA node, and SA node is situated in the right atrium. As impulses are generated from SA node, atria are first to get these impulses, and therefore cardiac cycle begins with atrial systole. Duration of atrial systole is 0.1 seconds. Here is the beginning of the cardiac cycle marked as 0 time. From this time, next 0.1 second is devoted for atrial systole shown in this pink color. The atrial systole will be followed by atrial diastole, which lasts for 0.7 seconds. Now, let us study the ventricular events. Ventricular events will begin with ventricular systole. After the atrial systole is over, ventricular systole begins as shown in this pink color, and the duration of ventricular systole is 0.3 seconds. So, it is occupying 0.3 seconds duration in this diagram. Please pay attention here. Ventricular systole begins after the atrial systole is over. So, atrial systole and ventricular systoles do not overlap each other. Now, why is that so? Delay in the AV node is responsible for delay in the beginning of ventricular systole, and this is the reason ventricular systole begins after the atrial systole is over. Now, once the ventricular systole is over, ventricular diastole begins, and this ventricular diastole lasts for remaining 0.5 seconds. Now, if you observe this diagram properly, we will understand that most of the atrial diastole is overlapped by ventricular systole as well as ventricular diastole, whereas this atrial systole is totally the part of ventricular diastole. It is the last part of ventricular diastole. So, this is the gross diagram indicating the various major events in the cardiac cycle. Now, let us study each event in detail one by one. So, as I told, cardiac cycle begins with atrial systole, which lasts for 0.1 second. This is the first event in the cardiac cycle and it corresponds to the last stage of ventricular diastole as we have seen in the previous diagram. Systole means contraction, and whenever any compartment of the heart is contracting, blood will be pushed in the next segment. So when atria are contracting during this phase, they will push blood into the next compartment, that is the ventricles. So during this phase, ventricles are receiving blood from the atria. Atrial systole phase is responsible for about 20% filling of the ventricles. As this atria are contracting, it will generate a small sound called as fourth heart sound, and this event coincides with P wave in ECG. Now let us understand with the help of this diagram. Shown in this line diagram, these are the atria, right atrium and left atrium. This is right ventricle and left ventricle. Shown in this red color are the atrioventricular valves, and shown in this blue color are semilunar valves. It is absolutely essential to visualize and understand what is happening to these valves during cardiac cycle so that you can understand various events. During atrial systole, atria contract. As these AV valves are open, blood will be flowing into the ventricle, but because of this active atrial contraction, blood will be forced into the ventricles. This is responsible for additional 20% filling of the ventricles. Pay attention that during this phase, semilunar valves are closed. So once atrial systole is over, atria begin to relax and filled with blood, and this phase overlap with most of the ventricular events. So we will move on to the ventricular events. First ventricular event is ventricular systole lasting for 0.3 seconds. It is further subdivided into isovolumetric contraction phase and ejection phase. Isovolumetric contraction phase lasts for 0.05 seconds and remaining 0.25 seconds is the ejection phase. This phase is further subdivided into rapid ejection and reduced or slow ejection. Rapid ejection lasts for 0.11 seconds and slow ejection for 0.14 seconds. First event in ventricular systole is isovolumetric contraction phase. Now what happens in this? Now atrial systole is over, which has pushed blood into the ventricles, and now ventricular systole has started. So as soon as ventricles begin to contract, first thing what happens is it will create back pressure towards the atria, and that will cause closure of AV valves. So atrioventricular valves will close. As these valves close, they will generate a sound called as first heart sound. So isovolumetric contraction begins with closure of AV valves and hence generation of first heart sound. Now AV valves are closed and semilunar valves are already closed. So ventricles are contracting as closed chambers. Blood volume within the ventricle remains same, and therefore it is called as isovolumic contraction. Please remember, volume we are talking in terms of blood volume and not the chamber volume. The ventricular muscle fiber length also does not change during this phase of contraction, and therefore it is also called as isometric contraction. Combine both terms together and we get isovolumetric contraction. So during this phase, ventricular muscle fiber length as well as ventricular blood volume remains constant. Because they are contracting as closed cavity, there is rapid rise in ventricular pressure. At the beginning of isovolumetric contraction phase, ventricular pressure is almost 0 millimeters of mercury, but within this 0.05 seconds duration of contraction, ventricular pressure, intraventricular pressure rises to 80 millimeters of mercury. And this phase coincides with beginning of QRS complex in ECG. So these are the events taking place during isovolumetric contraction phase. Now what happens? Ventricular pressure has reached to 80 millimeters of mercury. Aortic pressure during this time is 80 millimeters of mercury. Now ventricular pressure has reached up to that particular level. As soon as ventricular pressure exceeds 80 millimeters of mercury or diastolic blood pressure, semilunar valves will open and blood will be pushed into the aorta as well as pulmonary arteries. So this opening of semilunar valve stops isovolumetric contraction and begins the next phase called as rapid ejection phase. So even though blood is being pushed into the blood vessels, ventricular pressure continues to rise. So this left ventricular pressure will further continue to rise till 120 millimeters of mercury, and which corresponds to the systolic blood pressure. In case of right atrium, pressure rise will be lesser. It will be from 0 to 25 millimeters of mercury. As blood is rapidly ejected out in the vessels, ventricular blood volume will fall quickly. Also, there is decrease in the pressure gradient between the aorta and the left ventricle. So these two events, lesser amount of blood in the ventricle as well as lesser pressure gradient, will cause reduction in the rate of blood that is being pumped out into the aorta, and therefore this phase is called as reduced ejection phase. At the end of ventricular systole, most of the blood will be ejected out, and still ventricle will have some amount of blood left within them. So this amount of blood is called as end systolic volume. This volume ranges between 50 to 70 milliliters. I will repeat, end systolic volume is defined as amount of blood remaining in the ventricle at the end of ventricular systole. So let us quickly revise this ventricular event with the help of the diagram. Ventricular systole begins after the atrial systole is over and it lasts for 0.3 seconds. It begins with isometric contraction phase which lasts for 0.05 seconds, and during this phase AV valves close and there is generation of first heart sound. There is rapid rise in the ventricular pressure. As soon as the ventricular pressure becomes greater than that of their respective vessels, there is opening of semilunar valves and rapid ejection phase begins. This rapid ejection phase lasts for 0.11 seconds, and once there is reduction in the blood volume as well as reduction in the pressure gradient, the rate of pumping decreases and this phase is called as reduced ejection phase lasting for 0.14 seconds. Now here there is end of ventricular systole. Now ventricular diastole begins and it is lasting for 0.5 seconds. Ventricular diastole phase is divided into 5 subdivisions. First is protodorstol, very small phase lasting for 0.04 seconds, followed by isometric relaxation, first rapid filling phase, diastasis and second rapid filling phase. Now please remember, diastole means relaxation, and whenever any chamber is relaxing, it receives blood, so it gets filled with the blood. So first phase is protodorstol. Now this is a small phase between the onset of ventricular diastole till the closure of semilunar valves. Here the ventricular muscles they started relaxing, but semilunar valves are still open. Now as ventricular muscles have started relaxing, pressure gradient reverses. So blood begins to move from aorta to the left ventricle. As a result of this backflow, semilunar valves close. There is generation of second heart sound. AV valves are already closed, semilunar valves are now closed. So ventricle, they have become now again closed cavity, but now they are relaxing, and therefore blood volume within the ventricle will remain same. So it is called as isovolumic relaxation phase. Also there is no change in the ventricular muscle fiber length, so isometric relaxation phase, and so it is also called as isovolumetric relaxation phase, which lasts for 0.08 seconds. Now as ventricles are relaxing as closed chamber, there will be rapid fall in the ventricular pressure. As soon as it becomes lesser than atrial pressure, AV valves will open, and opening of AV valves marks the beginning of next phase of the ventricular diastole, that is first rapid filling phase, and it lasts for 0.113 seconds, or you can say 0.11 seconds. As soon as AV valves open, Whatever blood has been accumulated in the atria, most of it rushes into the ventricles. This causes about 75% filling of the ventricles. So ventricular volume increases rapidly. We have seen that even at the end of ventricular systole, there is about 50 to 70 ml of the blood remaining in the ventricular chambers. Now in this blood is rushing and this creates turbulence, so there is generation of third heart sound during first rapid filling phase of the ventricle. Now once most of the blood has been pushed to the ventricle, water blood is received by the atria, directly flows into the ventricles. So we can see a direct blood column from vena cava to ventricles, and we feel that heart has stopped momentarily in this phase, and therefore this phase is called as diastasis. Dia for diastole, stasis for stoppage. So stoppage of heart during diastole. This phase lasts for 0.167 seconds, or you can say 0.17 seconds. What are the features of this phase? This is the longest phase of the cardiac cycle, but minimum ventricular filling takes place during this phase. Also there is very little rise in the pressure within the ventricle as well as blood volume of the ventricle. Now 0.7 seconds duration of the atrial diastole are over at this point, and atria begins to contract again. So this is nothing but the last rapid filling phase or second rapid filling phase of the ventricle. So this phase corresponds with atrial systole. During atrial systole, atria actively contract and push about 20% blood into the ventricle, causing rise in the ventricular volume, and this phase generates fourth heart sound. At the end of this ventricular diastole, there is about 120 to 140 milliliters of the blood within the ventricle. This is called as end diastolic volume. The volume of blood present within the ventricle at the end of ventricular diastole is called as end diastolic volume. So we have seen that end diastolic volume is say 120 milliliters, and at the end of ventricular systole there is still 50 ml of blood in the ventricle. So that is end systolic volume. So if you subtract this end systolic volume from end diastolic volume, you get stroke volume. So that is the amount of blood ejected out during cardiac cycle. So let us revise this ventricular diastole events. Ventricular diastole lasts for 0.5 seconds. It begins with protodiastole lasting for 0.04 seconds, and at the end of this protodiastole there is generation of second heart sound, and now ventricles are relaxing as closed chamber. So this phase is called as isovolumetric relaxation phase, which lasts for 0.08 seconds. During this phase there is decrease in the intraventricular pressure. As soon as intraventricular pressure becomes lesser than that of atrial pressure, there is opening of AV valves and filling of the ventricles begin. So this phase is first rapid filling phase lasting for 0.11 seconds, and this generates third heart sound because of turbulence created by blood rushing into the ventricle. Now this phase will be followed by diastasis lasting for 0.17 seconds, and then there will be the second rapid filling phase or the last rapid filling phase, which corresponds to the atrial systole lasting for 0.1 second, and in this phase there is generation of fourth heart sound. Now let us study individual pressure and volume changes during the cardiac cycle. Now for this we will have it in the form of graph. So we are cutting open this circle. So first event is atrial systole. This will be followed by ventricular systole, and ventricular systole will be followed by ventricular diastole. This ventricular systole is further subdivided to indicate the small phase isometric contraction phase, and the rest is the ejection phase. Similarly, in ventricular diastole, it is divided into three gross events. This first includes both protodiastole as well as isometric contraction. Then is the first rapid filling and diastasis, and this is the last rapid filling, corresponds with this atrial systole. On y-axis there is pressure ranging from 0 to 120 millimeters of mercury. We will start with left ventricular pressure changes. So at the end of ventricular diastole, pressure within the ventricle is almost 0 millimeters of mercury. As soon as ventricular systole begins, there is closure of AV valves and ventricles are contracting as closed chambers, causing tremendous rise in pressure from 0 till 80 millimeters of mercury. So here in this isometric contraction phase, there is rapid rise in the ventricular pressure. As soon as ventricular pressure increases beyond aortic pressure, there is opening of semilunar valves and ejection phase begins. During this rapid ejection phase, ventricular pressure continues to increase. At the end of this phase, there is plateau. So this will be reduced ejection phase. After reduced ejection phase, there is protodorstol. Ventricular pressure begins to fall. Semilunar valves close, generating second heart sound. And after that, ventricle relaxes as closed cavity, and therefore ventricular pressure decreases rapidly. So there is rapid decrease in the ventricular pressure. As soon as ventricular pressure becomes lesser than that of atrial pressure, there is opening of AV valves. Opening of AV valves will cause inflow of blood, but still, because ventricles are actively relaxing, pressure will not rise. So pressure will continue to fall. During diastasis phase, there is slight rise in the ventricular pressure. During second rapid filling phase, there is slight rise in the ventricular pressure. Next, we will study aortic pressure changes during cardiac cycle. Aortic pressure will change between 120 and 80 millimeters of mercury. So at the end of ventricular diastole, pressure in the aorta is minimum, that is 80 millimeters of mercury. There is no change in this pressure during isometric contraction phase of ventricular systole, but as soon as blood is pumped into the aorta, pressure in aorta also begins to rise. It reaches to 120 millimeters of mercury, and in reduced ejection phase, it begins to fall gradually. At the end of protodiastole, it is almost 100 millimeters of mercury. As soon as semilunar valves close, the blood which was moving in backward direction from aorta towards ventricle now again starts moving in forward direction, and this change in the direction of blood flow causes little rise in the aortic pressure, and that is represented as diacrotic notch. And after that, there is gradual decrease in the aortic pressure to 80 millimeters of mercury. Now here is left ventricular pressure changes for your reference. So left ventricular pressure changes are taking place from 0 to 120 millimeters of mercury, but aortic pressure changes are taking place between 80 to 120 millimeters of mercury. Next, we will study atrial pressure changes. Whenever atria are contracting during atrial systole, there is rise in the atrial pressure, and this rise is represented by A wave. There is decrease in the atrial pressure in the second half of the atrial systole. Because of tremendous rise in the ventricular pressure during isometric contraction phase, AV valves are pushed into the atrial compartment, that increases atrial pressure slightly, and that is called as C wave. Then throughout the ventricular systole, the atrial pressure keeps on rising very gradually because they are receiving blood. At the end of isovolumetric relaxation phase, AV valves open and there is rushing of blood from atria to ventricle. This causes reduction in the atrial pressure. This wave is termed as V wave. After that, atrial pressure continues to fall gradually, and it will again increase during the last rapid filling phase where atria contracts actively. So here is again left ventricular and the aortic pressure changes for your reference. Now let us see the other changes taking place. First we will see the volume changes. Now we have another set of marking on y-axis, that is for volume. So it ranges between 50 to 120 milliliters. At the end of ventricular diastole, volume within the ventricle is maximum. So it is 120 millimeters of mercury. During isovolumetric contraction, there is no change in the ventricular volume, so it is a straight line in this phase. during ventricular ejection phase, as blood is pumped out, ventricular volume will fall, and this fall in the ventricular volume is rapid in the beginning during rapid ejection phase, and later it is slow. Then during protodorstol as well as during isovolumetric relaxation phase, again there is no change in the ventricular volume, and at this point ventricular volume is minimum, that is 50 ml. At the end of isovolumetric relaxation, when AV valves open, ventricles start receiving blood and ventricular volume rises. So this rise in the volume is greater in the beginning during first rapid filling phase, and later during diastasis there is a plateau, there is no much change, and further rise in the volume during second rapid filling phase, that is during atrial systole. So these are the ventricular volume changes during cardiac cycle. Cyclical changes taking place in ECG pattern also. So let us see that also. So atrial systole, it corresponds with P wave in ECG. Isovolumetric contraction begins with QRS complex, and the end of ventricular systole corresponds with the end of T wave. So heart sounds are also taking place along with the cardiac cycle in a cyclical fashion, and these heart sounds can be recorded with the help of instrument called as phonocardiogram. During atrial systole there is fourth heart sound which is called as S4. In isometric contraction phase there is first heart sound, that is S1. Then during isometric relaxation phase there is second heart sound, that is S2, and during first rapid filling phase there is third heart sound called as S3, and again during the second rapid filling phase there is S4, which is same as atrial systole, and this cycle will be repeated again and again. So this is all about cardiac cycle, various phases as well as pressure and volume changes during cardiac cycle. Thank you. If you enjoy my sessions, press the like button and share it with your friends. If you haven't yet subscribed my channel, press the subscribe button. To get notifications about new releases, press bell icon. Thank you for watching and see you in the next video.